Hello, everyone. My name is Rita Ovarah-oseh. I'll be making a presentation on the roles and responsibilities of a registered nurse. Within this presentation, I'll be talking about recent changes and their impact on the roles and responsibilities of the registered nurse, the Nursing and Midwifery Council and its impact on nursing practice, the implications of the NMC code on nursing practice and the role of the registered nurse will also be discussed. And finally, multidisciplinary approach in a healthcare setting and the importance of communication in a multidisciplinary healthcare setting. According to the Royal College of Nursing, nursing is defined as the use of clinical judgment in the provision of care to enable people to improve, maintain, or recover their health, to cope with health problems, to achieve the best quality of life, whatever their disease or disability, unto death. Nursing as a safety critical profession is founded on four core pillars, which are clinical practice, education, research, and leadership. To become a nurse, you must be registered with NMC after completing an approved nursing program of education, which include placement hours within a clinical setting. You must also be certified fit to practice. You must be LD to practice. Hence, a registered nurse is one who has successfully met the above criteria for registration set by Nursing and Midwifery Council (NMC). Nurses can qualify in at least one of four areas of nursing, which are learning disability nursing, children nursing, adult nursing, and the mental health nursing. Historically, nursing has been associated with caring, nourishing, and nurturing, as it is mostly believed to be a female job, though the nurse duties are diverse. A registered nurse is responsible for providing safe, high-quality care and assisting other health professionals to ensure patients receive the most effective treatment. The ROCN sees a registered nurse as a leader, a carer, and clinician who take responsibility for the care they provide to patients. Within the context of the NMC code, registered nurses are required to uphold their position and fulfill registration requirements set out by NMC, abide by laws and policies that protect vulnerable people and reduce any harm associated with their practice. They are also required to be honest and accountable for their actions and maintain the privacy and confidentiality of their patients. They must be compassionate and capable communicators. Nurses are also required to act as advocates and challenge discrimination and poor practice. Nurses must also ensure to work within the limits of their competence, ask for help if necessary, and complete training for new roles. Finally, nurses have a duty of candor to be transparent about all aspects of care, including mistakes. The roles and responsibilities of a registered nurse have been impacted greatly over the years. These factors can be grouped into political, economical, social, organization, technical, scientific, and professional, and a change in policies. Economic changes such as increase in public demand, rising costs, supply chain problems, and the aging population have had an impact on the roles and responsibilities of a registered nurse. This is because available resources derive drives what is made available for healthcare needs. Hence, nurses feel the impact whether in good and bad economic times. For example, bad economic times like the 2008 financial crisis, rising costs due to the war in Ukraine, and inflation can result in budget cuts, which directly affect nurses as wage increase might be frozen. Then we'll talk about the social changes in healthcare resulting from increasing pressure on services and funding, NHS, people living longer, the rising cost of care for vulnerable people. This also led to the introduction of new care approaches such as clinical care pathways, clinical guidelines, clinical protocols, and have made medical knowledge more accessible to patients. Political changes over the years, for the past 20 years, have a major impact on the roles and responsibilities of the registered nurse. The autonomy of nurses and other healthcare professionals, as well as their approach to care, have been impacted. As modern lifestyle is major cause of many illnesses, nurses' roles have changed to that of health promotion to achieve a healthier society by providing information and support that will help make better lifestyle choices. These changes have also resulted in nurses and other health professionals becoming more accountable for their actions and decisions. For example, the 1990 NHS and Community Care Act gave nurses more responsibility for health services expenditure, management, and resources. In 2014, the NHS Improvement Plan encouraged nurses to be more innovative as the creation of foundation trust resulted in a move from centrally directed system to a patient-led system. Also, the Health and Social Care Act of 2012 led to nurses assuming more specialist and leadership roles. Then policies have a direct impact on the roles and responsibility of the nurses and their healthcare professionals. This can result from professional organizations like the ROCN lobbying for changes to improve services. Nurses also have worked individually or collectively with government to adopt policies that will improve healthcare. For example, policies introduced between 1992 and 2002 allowed district nurses and health visitors prescribing rights. Also, the NHS bursary reform of 2017 resulted in the stoppage of NHS bursaries for new nursing, midwifery, and most allied health students. The removal of the bursary obviously affected the number of student nurse intake with direct impact on nurses as shortages and staffing pressures on nurses increased. Professionalization of nursing is a product of individual activism, cultural and political changes, scientific and technological development, as well as social and economic challenges. The key figures include Florence Nightingale, who founded the first training school for nurses at St. Thomas Hospital, London in 1860, thereby setting the standard for a modern nurse training. The second is Ethel Bedford, who eventually led the movement to claim professional standing for nurses, which culminated in the Nurses Registration Act of 1919. Professionalism have had a major effect on the roles and responsibilities of a nurse. This impact have led to 1. More control for nurses over their practice, improved patient care and job satisfaction, enhanced support system for career and development, more diverse mix of female and male nurse. The Nursing and Midwifery Council (NMC) play a key role in ensuring professionalism among nurses by upholding professional standards and ensuring registered nurses update their skills and knowledge regularly. Technological and scientific advancements have positively impacted the roles of nursing as tools and innovative solutions frequently developed is being adopted for use by nurses and other healthcare professionals. Nurses have leveraged technological innovation to improve their practice and help them deliver optimal healthcare to patients. These two solutions have resulted in use of computerized care planning, which is more efficient and cost-effective, better record keeping, timely access to critical patient health data, thereby helping them make the most informed decisions possible. Smart tools like electronic health records, automatic BP curve, electronic IV management, smart beds allow nurses to monitor patients' weight, movement, and vital signs and real time, thereby reducing the amount of time nurses spend on adjusting equipment and supplies for safety reasons. The Nursing and Midwifery Council is statutory regulatory body. Is a statutory regulatory body set up by Parliament through Nursing and Midwifery Order 2001 and was established in 2002. This role is to regulate nurses and midwives in the UK. They also have the responsibility of protecting the public by setting standards of all nurses' education, conduct, and performance. They serve as the independent regulator of more than 788,000 nurses, midwives, and nursing associates. Its vision is safe, effective, and kind nursing and midwifery practice for everyone. Revalidation is the process that all nurses and midwives in the UK and nursing associate in England needs to follow to maintain their registration with the NMC. This helps with continuous personal development and it is done every 3 years. This process encourages you to reflect on the role of the code in your practice and demonstrate that you are living the standards set out within it. It's important to know that the revalidation process is not about assessing your fitness to practice. These requirements for revalidation are: one, having 450 practice hours or 900 hours if revalidating as both a nurse and midwife. Have 35 hours CPD, including 20 hours participatory learning. Have 5 pieces of practice-related feedback, 5 written reflective accounts, reflective discussions, health and character declaration, professional and indemnity arrangement. The NMC recommends creating your own portfolio where your records are kept. The NMC in 2015 created the NMC code, which sets the professional standard of practice and behavior for nurses and midwives. This helps to promote safe practice in the workplace as it can be used by service users to provide feedback. The code is divided into 4 sessions: practicing effectively, preserving safety, prioritizing people, and promoting professionalism and trust. The NMC is mandated to act if a nurse fails to uphold these standards. The first standard of the code is prioritizing people. In nursing, this means putting people first always. The patient care and safety is always the priority, and their dignity is always upheld. The nurse must ensure that the patients are treated with respect and their rights are being upheld. If discrimination is weakness, it must be challenged. The second standard of the code is practice effectively. The nurse must assess the need of the patient holistically and then provide care to the best of their ability or advice on the treatment without delay. This treatment must be evidence-based. The nurse needs to communicate effectively with both the patient, the family, and colleagues, and help keep and maintain clear and accurate records. Any feedback given must be reflected on and acted upon to always improve. The third standard of the code is preserving safety. The nurse is responsible for ensuring that patient or public safety is not affected. They must always work within their own sphere of competency for safety of the patient and has a responsibility to raise any safety concerns immediately. The final standard of the code is promote professionalism and trust. Nurses have a responsibility to uphold the reputation of the profession by showing commitment to the code and be a role model of integrity and leadership. The NMC also investigates allegations about nurses who are not considered to be doing their job safely or effectively and give advice or issue warnings where required. Fitness to work, fitness to practice panels, conduct hearings when there are serious concerns and publish outcomes, maintaining confidentiality. Effective communication is an essential factor in nurse-patient interactions and a core component of nursing care. Effective communication helps to enhance the patient experience, reduce complaints, increase nurses' self-confidence and professional standing, improve job satisfaction, and reduce stress. The Social Care Institute defines a multidisciplinary team as a group of professionals working together, bringing together many skills and a lot of experts to deliver patient-centered care and to work towards the best possible outcome for patients. The multidisciplinary team can include different healthcare professionals like nurses, psychologists, occupational therapy, doctors, psychiatrists, health visitors, social workers, and other healthcare professionals. Effective communication is key within a multidisciplinary team, as it helps to facilitate smooth sharing of information, ensure problems are dealt with constructively and successfully, reduce compliance and conflict within the team, increase nurses' self-confidence and professional standing, enhance continuity of patient care, increase quality of care, and improve care experience for patients. For example, in February 2003, Victoria Clamby died because of severe physical abuse and neglect, even though she was known to 12 different services. There was poor communication and collaboration between the multidisciplinary teams in protecting the child. Also, the case of Baby P resulted in policy changes in safeguarding of children following public concern about the response of Harry G. Council to the death of Baby P. In August 2007, this was also due to communication failure by various services she is known to. Technology has strengthened communication between health professionals. Communication tools like Teams, instant messaging apps, Zoom, and Skype have been leveraged by nurses to communicate with their colleagues in real time. These tools make coordinating care much easier, reduce the time required to access test results, faster information sharing, improve communication, reduce risk of miscommunication and error. MDT approach have shown to produce better patient outcomes, better communication with patients and their families, improve team knowledge and skills, improve service coordination, and enhance decision making. However, study shows that multidisciplinary working has its own limitation as it breeds conflict between individuals and groups within the MDT, creates potential for lack of trust between colleagues, possibility of personality clashes, and poor communication, and likely result in the significant negative impact of care outcomes. Changes in healthcare resulting from political, financial, social, technology, and organizational reforms have made significant impact on the roles and responsibilities of a registered nurse. Most of the changes have resulted in providing safe care and improving the quality of patient care and their experiences. Nurses have also become more empowered and accountable with opportunities to advance into more specialist roles. The MDT approach and the availability of technology tools have strengthened communication between the healthcare professionals, enabling real-time exchange of information, faster decision making, and reducing the risk of miscommunication and error. Thank you.